Hello, friends and colleagues. In today's episode, I'll go through how to perform gastrointestinal exam. Thank you very much for tuning into my channel as well, where I upload um, educational medical videos and cooking videos hosted by Dr. YouTube. To visit my website for the examination notes, go to medicsforyou.webs.com. That's medics for you.webs.com. So let's start. medicsforyou.webs.com, Aussie exam, and search GI exam. So let's start. As with all exams, always ask the patient for consent. For example, Mrs. B, is it okay if I perform an abdominal examination, which involves me looking at your hands, your eyes, your tummy, and me having a feel of it? Would that be all right? Okay, so that's fine. And always make sure, especially if it's a female, to have a chaperone for you, so you don't want any medical legal cases. Start by examining the patient from the bedside. Is he looking well or unwell? Next, have a look at the hands. Are there any signs of hypoalbuminemia? For example, the nails looking white. How are the nails looking spoon-shaped, like what do you call them? Like koilonychia. Yep. So leukonychia is white, indicating low albumin. Koilonychia, remember, like a coil, like a spoon. So that is iron deficiency anemia. Look at the palms. Are they red? Indicating high estrogen level as found in chronic liver disease. Look at the antecubital fossa. For example, are there any signs of recent IV drug use? Also found in, for example, hepatitis causing chronic liver disease. Next, look at the eyes up there. Is there jaundice looking green? Is there any conjunctival pallor looking white, indicating anemia? Next, look at the mouth. Is the tongue swollen, indicating glossitis, also an anemia? Is there any angular cheilitis, also indicating anemia? Finally, look at the chest. In a male, you'd want to look for gynaecomastia, a sign of hyperestrogenism, also found in chronic liver disease. Obviously, you wouldn't find that in a female. Next, have a look at the tummy. Are there any scars, swellings, or asymmetry? The 5 F's is what can cause swelling: fat, fetus, feces, fetus, and fluid. Are there any scars, swellings, or asymmetry? Is there any caput medusae? So that is basically a swollen, distended abdominal veins. Ask the patient if he or she is in pain, because what you're going to do next is have a feel of the tummy. Start with a non-tender side to begin with. I tend to start in the right iliac fossa. So start with light palpation. You're basically feeling for any organomegaly or any areas of tenderness. The liver tends to enlarge downwards. So you want to start in the right iliac fossa to begin with, okay? Feeling the 4 quadrants: right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Feeling for any areas of tenderness. Following that, you're feeling for any organomegaly. As I said, this liver enlarges downwards, so you ask the patient to take a deep breath in and out. So as the patient takes a deep breath in, the liver descends down, and that's when you would feel for the palpable liver, the liver edge. Okay, so for example, if it's enlarged, the liver edge descends down, and you can feel the liver edge there. The spleen enlarges diagonally in that direction, so you would feel for this direction. Take a deep breath in and out. again, and out, and again, and out. You should not feel for, there should not be any enlarged organs. Next, you could feel for any kidneys. Do that by cuffing the hands behind the ribs, behind the rib cage, one hand behind and one hand in front. Okay? You're pushing them towards one another to try and feel for any enlarged kidneys. Again, that should not occur. Next, after palpation, you're going to percuss. So, percussing the 4 quadrants. Finally, you're percussing for any organomegaly. So again, percussing upwards for the liver, percussing diagonally for the spleen. Also percuss sideways for any ascites. So it would be dull if there were ascites, and the edges and the flank regions. Dull and then resident in the center due to gravity. After inspection, palpation, percussion, next is auscultation. You're listening for any bruits, which should not be present, but could be present in the presence of renal artery stenosis. To complete your examination, you'd like to do inguinal, inguinal, scrotal in a male, and rectal exam. To complete your examination, you'd want to ask your examiner or your patient if they're happy for that, but usually the answer is no. And that is it. So let's recap very quickly. Inspect the hands. Inspect the patient from the bedside, comfortable, uncomfortable, looking at the hands, koilonychia, leukonychia, and the palms, palmar erythema, in the antecubital fossa, any signs of recent IV drug use. For the eyes, looking for what's called jaundice, and also conjunctival pallor. For the mouth, looking for any glossitis, angular cheilitis. For the chest, any gynaecomastia. Inspecting the abdomen, any scrotal swelling asymmetry. Palpating for any tenderness, for any organomegaly. Paying attention in particular to that direction that the liver and the spleen descends. Liver descends downwards, the spleen descends diagonally. Feeling for the spleen as well. Palpation, inspection, palpation, percussion. Percussion, likewise for an organomegaly, but also for ascites, and finally auscultation, listening for any bruit. To complete your examination, you want to perform an inguinal, scrotal, rectal examination in males. Thank you very much. I hope that helps. Give it a thumbs up, share, subscribe, etc. Take care, and let's start feeling for tummies. Dr. YouTube signing out. Goodbye.